CHITREC is the Chicago Health IT Regional Extension Center, and we're the federally funded regional extension center for the city of Chicago. And our mission is pretty simple. We are assisting healthcare providers to achieve meaningful use of electronic health records.
We were very nervous doing everything. Both my secretary, Marilyn, and myself, we didn't know. And we really needed somebody to hold our hand.
Implementation managers at CHITREC are always, again, I think the personal touch of being available. It might be a phone call, it might be an email, and I will come out to the office if you're asking me for an in-person visit. That's part of our job, is to make sure people feel like they understand the issues they're up against.
I couldn't have imagined anyone trying this without CHITREC. They walked us through the registration, they walked us through the filing process. They were there all the way to the bank.
We're actually working with providers in over 80% of community areas in Chicago currently. We've helped dispense or helped providers receive over $9 million in federal funds.
The Alliance is what's called a health center controlled network. It is a strategy to help community health centers leverage some of the same economies and efficiencies and access to sophisticated resources that large health systems have achieved. But it allows them to remain independent, community-responsive organizations. The Alliance today has helped 31 safety net healthcare organizations in 12 states across the country adopt and use electronic health records and use the data coming from that to improve quality. And based on that kind of pragmatic experience we've had in adoption and support of technology, we've partnered with Northwestern to sponsor the Regional Extension Center, or CHITREC. It's a very nice blend.
One of the benefits of being based at a university, and if we have access to a number of world-class researchers here, and so what that enables us to do is to go out and seek partnerships, maybe even seek additional funding options to start some of these innovative projects that are centered around the implementation and use of electronic health records.
Health Atlas is something that's very exciting, and the idea was in the research setting to actually share the information from our patients across multiple institutions.
That allows us to have some insight into where there are pockets of disease and where there might be opportunities to reduce disparities in care that we see around the city.
We're doing a lot of really interesting research at CHITREC to understand usability, and first and foremost, we believe that usability is very important for widespread adoption and also effective use of electronic health records. We think that when doctors can provide care more effectively using electronic tools, it'll lead to cost savings and also better healthcare outcomes. But we also believe that there's a lot that we can learn about people to design better systems.
CHITREC in Chicago has been instrumental in bringing institutions together across the city, including my institution, the University of Chicago, to see whether the aggregated electronic health record information can give us a good picture of what the health of people is like in Chicago. The Community RX project, or innovation, is making use of data collected by high school students on the south side of Chicago, information about places, programs, and services that will talk to the electronic health records in community health centers and emergency departments on the south side of Chicago.
Collecting data, analyzing data is one of our core functions as a Department of Public Health here in Chicago. And now we're getting more and more interested on that intersection between clinical medicine and public health. So what happens in the clinical sector, the way it's documented, the way the data is collected is extremely critical for us as a Department of Public Health and help us understand population health.
We see ourselves essentially as a hub, a gathering place where people can come to who have exciting ideas, exciting interventions they want to do, exciting projects they want to engage in health IT. And we want to be that convening, that central hub for providers in Chicago.
We're only beginning to see the beginning of the return on the investment in health information technology. As data becomes more and more available, as the tools within the EMR become more and more efficient to help prompt decision-making at the point of care, and as information becomes more available at an aggregate level for us to be able to look at trends on a system level and a regional level, we'll begin to see tremendous advances.